So America has gone through lots of traumas lately. The Chile school bus kidnapping, if you know, I was reading about it. And talk about trauma for that group. I don't know if you know that those children were seen by, I think, people in the mental health and said that they were going to be okay. And they had all kinds of trauma, nightmares, and then they finally got to get some therapy. And the enormous trauma that they were feeling, the feeling was, but when a child is having trauma, it's like they don't think of, am I going to survive it? Am I going to die here? And in children's hospital, this is what many times children will ask the doctor, am I going to die? You know, and when we can get parents to come in and talk up to the child, tell us about what your fears are, what are you doing, what you think about. Not to be afraid of their child saying to them, Mom and Dad, I think I'm going to die. I want to go home. I know I'm going to die. I don't want to die here. It's too lonely at night. It's dark. I hear people crying. I want to go home. And so you hear this from the nurses. And I have no idea how nurses do it. I worked there for a while in the psych unit part, but because I was trained paramedic, when they were short help, I'd go up and help. But if you work with children who are sick, there are particular kinds of cancer that hit children that they don't have the ability to fight it out. And children come from all over the world thinking that Stanford University is going to cure all because it's Stanford and doctors are miracle workers. When the patient dies, when the child dies, many of the families become really angry at the doctor. How could this happen? You are a Stanford doctor. How could you let my child die? Even though we talked about it more and a lot, you know, and it's the talking ahead that is who is the most resisting. Try to get the parents. Now, this is children in the adult hospital. It's like the opposite. The doctors are saying, don't say the word death. But in the child realm, it's, you know, it's okay. Because why? Because almost all of the children thinking, I'm going to die here, because that's what they see in the movies, that's what they think of. They're feeling so bad because they can't get up and run around and play. I guess I'm going to die, because everybody goes to bed. It's like one kid I had to consult with, he was maybe 8 or 9, he needed some kind of surgery. He goes to the gas guy that does the gas, what's it called, the anesthesiologist, says to him, it's going to be no problem. You're just going to fall asleep and you'll wake up. And the kid freaked out. Because what happened a few months before that is that what his dad told him when he asked, Dad, how did Mom die? What happened? Well, she just died in her sleep. It wasn't true. Mother died of cancer. She didn't want any medical treatment. She just wanted to die at home with her family because there was no cure for that cancer at that time. He stopped talking. He stopped eating. So I went to see him. And so I would sit just there for maybe the first 2 or 3 days, not say a word. He wouldn't say a word. I would just say my name and I'm here, and when you want to talk. And then I'd come back again the next day. And so one day, he sort of like was looking, facing out where I was going to sit. He turned around and he says, not you again, what do you want? It was like the first words kind of thing. I knew now it was going to start. I waited. About the 7th or 8th day visit every day. And this was expensive for them because it wasn't in my office. I had to go, and I wasn't working there in the hospital at that time. And he said, I started to, sort of like, I wonder if I was lying like you in the bed, I'd be wondering what I'd be thinking of. You know? And so he started to change a bit, started to talk. But it took, you know, sometimes it is slow, so slow with children who are hurting, who are feared and frightened, to sort of come out. But when you stay with them and you're not afraid to wait, and you're not afraid, and you stay with them and you're not afraid of them hurting, you're not afraid of their pain, you're not afraid, and you're not sort of pushing yourself on them and say, I can help you if you'd only talk to me. You don't sort of do that, or come with crayons, oh, please draw a picture for me. Oh, no, wait till they ask for something. And you wait, and you wait. It's going to happen. Why? What helps a child when a mother dies, and what helps a child in general? What do they look for? Consistency. They look for the same caretaker. You know, if the mother dies, that the father can come in and be the caretaker continuously. This is what the children need. Or if it's the uncle that can be that caretaker. It's not like they're shipped around from one person to another. This is very traumatizing. They sleep from different houses. To keep them in one place where they're sleeping, telling them the same story all the time. How did mom die? How did dad die? Da, 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 da. They just tell them the truth, but just tell them little bits all the time, because they cannot take more than once. Oh, okay, mom died of cancer. All right, thank you. You know, they're gone. They come back 5 minutes later, like this one woman asked, my daughter wouldn't ask me, I'm taking the turkey out of the stove in the middle of a house for first Thanksgiving after dad died. Well, how did dad really die? She never asked it before, for almost like 9-10 months later. Right when she's had this burning thing coming up. And mother said, well, could you ask me later? The kid sort of disappeared. And a few days later, you know. So it's like these vulnerable moments when we are feeling a little vulnerable, they're able to come in, sort of like perch right on your lap and say, could you tell me that moment? How did mom die? So that's a bit of the difference. We can say to another adult, could you wait for a minute? The mother now is feeling awfully guilty. Oh, gee, like I had a chance. The poor lady was just feeling awfully miserable throughout the day, trying to get her daughter to be a part of it. So these are kinds of things that you'll see differently in that. So talking about this Chile kidnapping, how traumatizing it was for that. You know, like when the Challenger blew up, that children were sending notes around with one another, I want to die too, you know. They were doing that, and finally the school was saying we're all fine here, and finally they called in some help.